Now, the Trump administration's freeze on foreign aid, including life-saving HIV, malaria, and tuberculosis drugs, threaten millions in low-income countries like Nigeria. Programs like PEPFAR, which provide essential HIV treatment, face disruptions, risking increased transmission, drug resistance, and reversed progress. Now, though a waiver later allowed some exemptions, but uncertainty persists, affecting vulnerable groups and causing clinic closures and job losses. Health experts warn that failing to control HIV in Africa could have global consequences, likening it to the COVID-19 pandemic. Now, to discuss more on this, we are joined by Dr. Yahya Disu, his Executive Director, AfriHealth for Social Development and Impact in Abuja. We also have joining us Dr. Ibitrokoemi Faye-Korubo, his consultant endocrinologist and diabetologist, acting head of Department of Internal Medicine at RSUTH in Lagos, and also Dr. Doyin Odubanjo, his Executive Secretary, that's the Nigerian that's the Academy of Science in Lagos. Thank you so much for joining us, doctors.
Afternoon. Nice to be here with you.
Thank you. All right, now.
Thank you for having us.
All right, it's a pleasure to have you. Let me begin with Dr. Disu. Dr. Disu, now this particular incident and, the cut in funding when it comes to life-saving treatments like HIV has actually caused so much pain to so much, countries. Now, it is said that donated drug supplies, have kept 20 million people living with HIV alive. And, the stoppage is so abrupt, and with that in mind, what are the immediate health risks for these 20 million people if they suddenly lose access to treatment? Dr. Disu.
Thank you very much. And I think the win we have and the progress we have recorded in the HIV space has been the availability of treatment and access to treatment, which has reduced the viral load to the level that the risk of transmission is so reduced, and so almost zero. Now we have discordant couples. Husband may have HIV, the woman, the wife may not have, and two of them live together. They have children just because the person infected is on drugs. So the risk of transmission will go back, because if these people could not access treatment, and you know what that means. It means that all of us are now at risk, because it's not only through sexual transmission you have HIV transmitted, and then there are other means by which HIV could be transmitted. And then you have a true blood transfusion, and then you also have people who probably won't be able to have their hair cut, and then I'm not sure many people still observe sterilization of what they use in having their hair cut, or when they want to have manicure and so on and so forth. So the risk also when it comes to mother-to-child transmission is also going to increase, because pregnant women who live with HIV are on drugs, they place them on medication that reduce risk of transmission. So this buttresses the fact that what public health is doing is actually appreciated, because with that public health intervention, everybody seems to be calm of the dangers of HIV. It's not that HIV is not there, but you even see that people on treatment, they live a normal life, and they also work, they are integrated into society. This is not the era that you see somebody who is experiencing weight loss and you start suspecting HIV. So, and the stigma has also reduced. All those will come back, and that has implications for us. Even the healthcare workers will also be at risk. They work in the hospital. So when we talk about key group, people at risk, people who have high risk of getting this disease, it includes the healthcare workers who treat this the HIV infected persons in the hospital. So which means that we're all at risk, and already the healthcare system is already strained because of brain drain. and then you have the ones that are behind, also exposed to the likelihood of getting this HIV infection. And those who transmit it, those have to manifest the disease before they transmit. So it's enormous.
Okay.
So the fact that people are even talking about it also shows that public health intervention has been working. So it's something that all of us need to put our hands together. It's not what one country can do. It needs collaboration, especially Africa, where we are most vulnerable. Thank you.
All right, now let's hear from Dr. Faye-Korubo on this, and the immediate health risks, that 20 million people might face suddenly, if they lose access to treatment.
Okay, so good evening and thank you for having me. I think the first thing to remember here is that the provisions of the highly active antiretroviral therapy, it's provided for patients living with HIV. It has given them a lot of hope. It has helped them, adjust to regular life. But beyond providing the drugs, this voluntary testing and screening, which is very key in prevention and diagnosis of HIV, it was promoted by the donors. So beyond the drugs, the donors also promote screening, promote that early diagnosis. This HIV screening is free. All this is part of, the largesse of the donors. Now, apart from that also, health workers are trained on preventive trips by the donors. So you have people that come in that are volunteers, that are taught how to counsel patients living with HIV before, during, and after screening. And all this will be affected if we're not prepared. So it's not just about the drugs. It is about the entire process of caring for people living with HIV, from the point of screening, diagnosis, and then the care after diagnosis.
Oh, okay. Now, over to you, Dr. Odubanjo. Now, we know that Nigeria depends heavily on PEPFAR, with over 2 million people living with HIV/AIDS and more than $6 billion already invested in its response. Now, what quick steps should Nigeria take to safeguard these patients, during this aid freeze?
Since what we have is a funding freeze, there is nothing you can do other than to find a way to bridge that funding gap. The truth of the matter, though, is that Nigeria, in all honesty, is not a poor country. I mean, that's debatable, I know, with many people, but Nigeria is not a poor country. And we can afford, even if it's just a temporary measure, to put in some funding to block that missing beat that we wouldn't get for the moment. The truth also is that Nigeria is not an aid-dependent country, okay? Meaning that the majority of our funding in healthcare is not from aid, like some other countries would have it. I can't give you the exact figures, but just like the South African president responded and said, look, what we get is just X percentage of it, and we wouldn't die without that. They still have problems in the immediate sense, but what you do is find other means to plug that hole. However, on the longer term, I think sometimes when you face this kind of things, it's a blessing in disguise, as it were. And that is to say that we oftentimes have ignored what we have. We have ignored our capacities, our capacity to research, our capacity to produce locally. This is now just for HIV, as it were. But again, we've had a problem for a while. Even malaria drugs and things are becoming very expensive and unreachable. However, if we will plug that gap also on a long term, by looking locally, by developing our research capacity and our capacity to manufacture locally, we would have less of a problem even with the funding, because it should end up being cheaper. So I think that's the way to go. Plug the hole momentarily and very quickly get to work on local research and production.
Very important. Now, Dr. Disu, how can the international community, work together to fill this huge funding gap in global health, especially also looking at the fact that the U.S. and Argentina have exited the WHO?
Okay, it's actually a wake-up call for international community to understand how they need to work together. It's a problem of everyone. The health threats anywhere, it's also a health threat everywhere. So there are challenges. When challenges come, then what we need to do is to look at how to navigate and then come up with a solution. This is the time the international community needs to come together. HIV, though, may be more prevalent in certain countries, but it's still a problem of everyone. I will give you an example, just to tell you a recent development even in the United States concerning the avian bird flu outbreak. And then the report that we read was that this was brought to US by migratory birds from Europe. So now, if we say that certain countries will not participate in global affairs or global effort or network.
Funding.
For the migratory birds, do they know that? And those birds, they are seasonal, they undergo seasonal migration. At some point, they will move from the US again back to Europe, even as far back as Asia. So, and that's where the concept of One Earth approach is coming in. So One Earth has been a conversation, and then which I think needs to be strengthened. And then countries who are member states need to also review their system and then to check how they can promote local initiatives. Like for instance, Nigeria was talking about swap approach, whereby they want to unlock the value chain, integrate systems. HIV should not be treated as a vertical program. And then I think this is an opportunity for us to integrate HIV with our health system, our routine health system. Especially primary health care should be supported, should be strengthened globally. And then each country should see how they can increase funding to their primary health care system, recruit health care workers, train them, and then primary health care centers, and ensure that there is access to health care in every ward and in every community. Ensure that community are really involved.
But I think the first step would be to actually be able to, provide infrastructure and also to maintain these healthcare centers. Can you hear me? I think the first step would be to, provide infrastructure for these healthcare centers, because we know, how the healthcare centers are, how dilapidated they are. We've seen, videos. We've seen how, abandoned they are.
Oh, yes, I agree with you. That's why I said that we need to strengthen our primary healthcare system, which is the bedrock of any healthcare system of any nation. And then there are a lot of challenges: infrastructure, manpower, access to medicine, medication, and then even access to information is also very key. And to ensure that information is available in a form that people can understand, that is delivered at their literacy level. Because if people don't even know what you are talking about, no matter how much invested you are put in the infrastructure, the diagnostic services, and then the treatment services, and then they won't be able to access it. So it's all of society approach that is required. So even the settings where they have functional healthcare system, they should start thinking of how do we ensure we eliminate disparities, because it's not everybody that have equal access to these services. We need to also start thinking of investment in technology, because with technology, we can optimize service delivery. And we can ensure that even our rural communities, if they can even have access to technology that can give them access to information and to be able to do consult, you can even do consultation online. People can have opportunity to interact with their physicians, even where we don't have anyone available. So the global funding that is available and the local funding or with local efforts should be harmonized to ensure that we build our community, we build community resilience. Community are part of this. The access to infrastructure, technology, medicine is a priority.
Okay.
So I think that's also in line with the swap approach in Nigeria. I think if they are serious about it, I think it can get us to where we desire to be.
All right, now let's hear from Dr. Faye-Korubo. Now, you'd agree with me that, every decision has consequences. Now, what are your thoughts on the fact that 60 senior USAID officials have actually been placed on leave during this freeze? How do you think this would affect ongoing aid projects?
Well, I think the first thing to note is that we have depended on free funding for too long. It's rather shocking that we are all alarmed because a country has decided not to send us money to care for our people. And I think that the ability for one to be able to care for one's people is the basic feature of being civilized. That's the first step. Now, the other thing about the USAID and the officials on leave, they have been accused of a lot of fraudulent practices, including sponsoring terrorism and a few things, as you are aware. Yeah. And so America has its own issues that it's trying to sort out itself. A new government is in place, and the government believes that America first, and they think that they should clean house. The issue is this: whether this decision came in today or a decision that would have happened 5-10 years from now, we can't keep depending on freebies. We can't expect another country to fund care for our people. Like previously mentioned, what we ought to have done now would have been transfer of technology, which would be the ability for us to be able to produce our own drugs and produce the diagnostic strips. I keep stressing that even the strips, the testing for HIV is free. And you must understand that the fact that it is free has made more people come forward to test. So yes, they are on suspension. It's an American issue. USAID, America is trying to clean house. But the story is Nigeria, how are we getting ready for eventually this? Let's imagine that this funding never comes back. How prepared are we to care for our people by ourselves? What of the training? How ready are we to ensure that our staff, our people are well trained, for this? So this is, I think, the issue at hand. The bottom line here is that a country has decided not to spend money for us. Now, it is not just the money for the drugs. It is, again, training of our people, preparing our people for eventualities like this. The screening for the patients, the counseling for the patients, the care for pregnant women. This is all part of the whole package. So, America has done what they should. Nigeria should be ready to take the bull by the horn and care for our people by ourselves.
Well, Dr. Korubo, still on you. Do you think that, the recent waiver, for life-saving humanitarian assistance, is actually enough to keep PEPFAR's critical work going in the near term?
Well, I don't think it is enough. My view is this. Nigeria should be ready to eventually take over the entire program ourselves. I'm aware that in the recent budget approved by the National Assembly, funds were put in because of the removal of the global funds, the American funds and a few other funds for us. But like I said, that is not enough. So I think that whatever measures that have been taken as short-term measures, in the long run, whether today or tomorrow, eventually these global funds will stop. We should be ready to take over ourselves.
Okay. Now, Dr. Odubanjo, experts have actually warned that, if a pandemic hits Africa now, everyone in the world could be affected, especially in light of, lessons from COVID-19. How will these aid cuts, spark a broader global health crisis?
Well, again, I tend to differ many times. And I must say that this talk of Africa as the dark continent, as the dependent nation, as the one that need help, I think is a narrative to keep us down, I think we need to realize that Africa is not what we are often told it is. I like that you pointed out COVID-19. I dare say that almost no continent did as well as Africa, in containing COVID-19. Bearing in mind that the initial prediction was that Africa will be flooded, the streets will be flooded with bodies, and everybody will just die in Africa because Africa is weak and all of that. Africa can't handle it. But then it didn't happen. And then again, people started postulating all sorts of reasons. Oh, it's the weather, or it's this in Africa, or it's that in Africa, But again, and thankfully, Dr. Disu is there, who knows. Back in 2014, we were both working on the Ebola containment. And I always tell people, and I still spoke to him, to Dr. Disu recently, that the real story of that has not been told. I tell people internationally that just look at the situation. Nigeria had 20 patients, so let's take apart from the first patient, the first patient, which is Sawyer, who came in, so nobody knew what it was at that point in time. But afterwards, we had 20 patients in total. But none of the healthcare workers who were intentionally taking care of the 20 patients caught the disease to start with, and it didn't go beyond the 20 patients, and it was stopped in 93 days. Now, America had about 2 patients, maybe 3, if I remember correctly, that were flown from Africa, having caught the disease, being health workers and things, to be treated in America, and, people in America in the hospitals with all their high-tech facilities and all that caught Ebola from those patients. So I always say, don't underrate what we have and what we are, But that said, that's also to, join hands with even Dr. Faye-Korubo, what he said, which is that let's just sit up. Let's sit up. That's what this is. When Cuba was cut off, as it were, by American sanctions and things, we discovered that Cuba became a haven of healthcare. They developed in healthcare to the point where Cuba started sending, health workers around the world to help with pandemics and what have you. When we had Ebola, they sent a team to Africa, So, but we need to just look down and realize that we have a lot to offer the world. By the time Nigeria stopped Ebola in 93 days, we sent our teams, to Liberia and to Sierra Leone. And that's when the thing was curtailed there in those places. Those are stories that have not been told, So there's a lot we can do. There's a lot we have. That's not to say that this is not an issue. But I like the approach, and I align with that very much of Dr. Faye-Korubo, which is to say, why is somebody coughing in America and we're all shaking here? Let them do what they want. But let this be something that just wakes us up to say, hey, sleeping giant, it's time to do what you can do.
All right, Doctor.
Because you really can.
Dr. Odubanjo, speaking of, having something to offer, what about breakthrough treatments like lenacapavir, which is said, or that is said to be a twice-yearly injection promising near-complete HIV protection, which is in the works at the moment. Do you see the current supply disruptions impacting the rollout of such innovative therapies?
Yes, definitely. However, what I'm also saying is that who says that we can't have innovative therapies coming out of Africa? In fact, that one of the biggest places for biodiversity left in the whole earth is Africa. And what that means is that we also have a huge herbal constituency from which we can find many drugs that we can use. So as much as that has been discovered, we have human resource. We know that definitely for Nigeria. When the vaccines were being found in America for COVID-19, we discovered there were Nigerians in that team that discovered those things. Okay, so we have human resources spread all over the world. We have the human resource, and we have the biodiversity. We only have to be pushed to work, which is what I'm hoping this will do for us. That this is going to push us to really to get started and to do the work that we can really. And while we may not get such things in the immediate, we'll probably come up with other things that even America would now desire to have. and will be begging us for.
Okay.
Thank
now I think we'll take a quick break, and when we come back, we'll definitely continue with this discussion. Please stay with us. Welcome back, and thank you for staying with us on the conversation. We're still discussing the funding cuts by the U.S. and also how it will affect HIV/AIDS and other diseases. And we still have speaking with us Dr. Disu, Dr. Faye-Korubo, and also Dr. Odubanjo. Thank you for staying with us. Now, let me come back to you, Dr. Disu. Now, we've actually heard that we've heard of patients like one in Nairobi that was being turned away due to drug shortages. Are there practical logistical solutions that could ensure that people do not miss their vital medications?
So, in a situation like this, it calls for urgent review of our logistics system, and each country needs to prioritize these categories of patients and look at efforts to ensure that access is not disrupted. And I quite understand that some of these people providing this treatment are also paid by, what's it called, by these donors, paid from donor funding. And I think, just like what Dr. Odubanjo and Dr. Odubanjo said, we need to take ownership of this and then ensure that we integrate HIV services, whether prevention of into our routine services, so that our routine healthcare workers will be doing that. Even if we want to have special clinics, it should still be by our routine health workforce that are trained. And then in terms of the logistics supply, and I don't know, some countries you already have stock. For instance, when I inquire about Nigeria, I learned that they still have some drugs in stock that before they even exhaust this, probably with the funding that the federal government of Nigeria has made available, they will be able to procure the next set of drugs. So for such countries, and even within the country, there could be some states or some LG at the LG level that they have issues, having issues with access. So a quick review to understand the challenges of peculiar centers, and then to ensure that this is quickly addressed as much as possible with all the policy, the expertise, and use of technology that's like I mentioned earlier, to track supplies and to know when they stock out and then where they need to quickly replenish. So it's unfortunate that it's happening, and then that means that it's not just the building capacity of our health workforce, but it's also to review our logistic system and the supply chain to ensure these drugs are readily available, positioned where they need to be available. So everybody that needs to do their job needs to be held accountable for what they are doing, because this is investigated. It may not be actually there is no drugs in the country, but it will be that making it available at where these services are rendered at the point of treatment. So, that's why I said we need a quick review. And then when we involve the community, we can learn from local TB intervention programs, where we have local community, they call their members, they call them treatment support group or treatment supporters, that ensure that people who are on drugs, they visit the centers where they are supposed to take their medication. They are liaising with officials who are supposed to make this medication available in those treatment centers. So, and then involving the community, using community participatory intervention or approaches will also help us to avoid these kind of things in the future. So we need a quick review of this. And I think this is an opportunity for us as a country where we want to take ownership to look at our own internal mechanism, initiatives or innovation that can ensure that access to treatment is uninterrupted and is also improved. And then donor funding also comes with some conditions, some restrictions, and which is will also cause some collateral damage in a situation where they suddenly withdraw like this. So I think that that's a lesson for us to learn from, to see that even if within the country, we could also have a similar challenge too. What measures have we put in place? Each state, each local government needs to be on top of the game to ensure that we protect these people, because they have rights to life, rights to treatment, and then also it also benefits people around their families and the members of the community from transmitting this disease to them. And then everybody will work, and it translates to better economy for us as a nation. So it's something that we really need to prioritize. I think that's what I will say for now.
All right. Now, Dr. Odubanjo, Dr. Disu did talk about, improving our internal mechanisms. And, UNAIDS reported that new HIV infections actually dropped to 1.3 million in 2023. That's a 60% reduction since 1995. Yet, estimates suggest that infections could surge to 8.7 million by 2029. Now, while we wait to, for Africa and also Nigeria to get, its act together, what should international donors focus on to prevent such a dramatic reversal?
Well, again, on what it depends on what their projections are based on. So why do you think it's going to surge to? That number. Also, you have to realize that, like most things, and like most epidemics, pandemics, diseases, there are many approaches, to prevention. It's not just drugs. As a matter of fact, I think that we have underestimated the power of other things. I usually tell people that diseases or the spread of diseases is driven by human behavior. So one of the biggest things you need to achieve is behavioral change. And so if you are thinking of how do we prevent this, then you start looking at those other methods, and especially the things that can alter behavioral change. How do we, because it's the easy way out for you to say, oh, if you get this, we have this drug for you, or take this drug so you don't get it. It's the same kind of discussion you get around almost all diseases. So in recent times, we've had that discussion around the malaria vaccine, the newly introduced malaria vaccine, for instance. And people just think, so once we have a vaccine, that disease is no longer a problem. As a matter of fact, in my view, the vaccine or the drug is your last, is your last frontier. To really use to prevent it. You should use the other things. And if you want sustainable prevention, then behavioral change is what you actually need the most. And in that case, things like focusing on health education. How do we encourage our health education programs, ensure that people are better informed about what this is, how this spreads, how to prevent it, what they should be doing, what are the risky lifestyle choices, that drive this, and what are the alternatives in terms of behavior. So if we drive things like that, we will prevent, this kind of gloomy prediction. If at all you get a surge, because of course there'll still be a gap left behind from this kind of situation, but you won't get anything nearly as much as that. And not only so, it also means that what you will achieve by having achieved behavioral change will be more sustainable, because again, I think as has been said on this program now, what tells you that even if the US restores everything tomorrow, there won't be another situation in 6 months' time. There won't be something else that will happen, may not have anything to do with the US, but how do you know that something can't go wrong again to disrupt drug supply and things like that? So we need to understand that diseases and disease prevention is multi-pronged, and you should go to the other approaches that are less affected or not affected, and in particular, don't underestimate behavioral change management, which primarily you drive through health education. Thank you.
Well, Dr. Odubanjo, you just talked about projections and also some preventative measures that should be taken. But, does that also apply to children? Because speaking of projections, there's been warning of 6.3 million AIDS-related deaths and 3.4 million orphaned children by 2029 if this freeze continues.
Absolutely it does. Starting from the one that we're not likely to think about, which is the newborn. The newborn gets it because of the lifestyle choices of the parents. Okay, so the prevention of mother-to-child transmission that Dr. Disu was mentioning, it's because the mother had it in the first place. So if the mother doesn't have it, there's nothing to pass across. If you look at what else, however else children might get it, of course, what I'm saying is not 100% prevention rate, but what I'm also saying, if we cast our mind back, it used to be that school health programs were a major thing for us. All of us went to school, and in school they drove our healthcare behaviors very largely. They would check your fingernails periodically. They would check your teeth. You get punished if your nails are too long and dirty and all of that. They will have classes where they teach you about healthy behaviors and nutrition, and also we all knew balanced diet and all that. And some of those things, in fact, you use children to even educate some of the parents who were not that enlightened. So it does include children. This kind of prevention programs does include children. Children can be uptakers of this and can even be drivers of it as well. But like I said, this prevention is multi-pronged. So it's not one approach takes it all. But it only means that if you have been neglecting one approach before, because it's easier to just give a drug, it's easier to just give this or that, then now you have to rely more on those approaches we have ignored, and push them even harder than before.
All right, now, Dr. Disu, now you all sound, very positive while, giving solutions on what needs to be done and what can be done. But, we've also talked about some of the drawbacks that would come with this particular freeze. So I want you to tell us if you feel that really that there is a possibility that, once there's a reversal or once, some of these drawbacks actually come to play, that there's a possibility that we in Africa can recover from such setbacks. Setbacks that have taken decades of progress, decades, that's taken decades of progress against HIV/AIDS.
Oh, sorry, there was breaking transmission. I didn't hear your last question.
It's still the same thing. Yeah, it's still the same thing. I was just talking about, because critics actually said that this particular freezing could undo decades of progress against HIV/AIDS. So is there a possibility that we can recover from such setbacks that are to come? All right, we just lost Dr. Disu. Let's hear from Dr. Faye-Korubo, still on this.
Well, I think the first step here is to ensure that we have our statistics right. Now, we've heard clearly that there are many steps to prevention. And of course, we must remember here that unprotected sexual intercourse is not the only means of acquiring the HIV virus. Mother-to-child transmission is there, as we notice, sharing of sharp objects. And there is another way that we always seem to overlook, which is, people receiving poorly screened or unscreened blood or blood products. So it's very important that we keep all these measures in place to prevent infections. Now, the other thing here to remember is that lifestyle choices have changed over time. There appears to be, in my view and in the view of many other experts, a denial of the presence of HIV, especially amongst a certain class of people, the Gen Zs. So the usual abstinence, being faithful, using barrier methods like condoms are no longer practiced. And this has, over time, increased the incidence, new cases of HIV coming. So again, let us not forget that one of the things the global funding has been able to achieve is education. The global funding is not, again, just used for purchase of drugs. There are a lot of, information dissemination to at-risk population. There's a lot of training of health workers so that they themselves stay safe. There are many aspects of prevention that the Global Fund helps that this absence of the funding may affect. So the message, the way forward is this. Should these global funds come back, we must continue to shadow them. We must have our own people being trained. We must have our own policies clear so that if an issue like this ever comes, we will not, be found wanting. We should have data on the availability of drugs. I'm aware that we should have at least drugs available for the next 3 to 4 months for our patients. And, these data would help us prevent issues like this. So I think that's the issue. The absence of the funds can increase the incidence of people coming up with HIV/AIDS. And the reason why is because of, one, education, which is a key milestone in prevention, is being sponsored. There are TV adverts, there are flyers being given, there are outreach programs being done, all parts of the funding that will not be there if the funds are not there. That means that when government is planning to take over the intervention, they must remember these other aspects that are key in bringing the incidence down. Again, like I've always said, voluntary testing is key. There was, in the past 4 or 5 years, situations where patients would walk in and as a routine would want to know their HIV status. And the stigma attached to being HIV positive had gone down, and you would have situations where people discover that they are HIV positive and they would, come for treatment. Remember also that there are now home kits. So you have kits even with saliva, because the initial fear was, you're going to have to prick my blood. But now you have home kits with saliva tests that you can do and to know your HIV status. All these were provided by the funds. So this is how deep the absence of these funds could affect us because we are unprepared.
Oh, okay. Now, Dr. Odubanjo, let's have your final thoughts. If you want to speak on if you feel we could actually recover from, setbacks that come with undoing decades of progress against HIV/AIDS as well, you can please go ahead and speak on it.
Well, it's human nature to recover. I think one should never think that there's something that can happen that we can't recover from. So we may lose ground, here and there, but we should just get ready. And I think that's the overwhelming message I hear even from my colleagues online here on this program, that we should just, take advantage of this. This is, we can't continue to be totally dependent. Even if this was restored, the funding was restored, we should not let down our guards. We need to now realize that, because again, nobody thought this was going to happen. Nobody thought, we all knew America first was the mantra, but nobody really thought that they would just stop USAID and cut this funding and cut that funding just like that, immediately like that, completely, not even sometimes reducing it. So nobody was, saw this coming, as it were. But now we have seen it, not just coming, but we have seen it in reality. And what that says is what many people have been saying, which is don't depend on these things. Let's do what we need to do. Let's really get to work and start funding the things we should fund and make sure that we're actually independent of aid completely, which is possible. We can do it. Thank you.
Okay. Let's hear your final thoughts as well, Dr. Faye-Korubo.
Well, I think my final thoughts would be this. This is a wake-up call, and it's time for us to act now. Let's have our systems in place, and even if the funds come back, let's have, say, a 5-year plan where in the next 5 years we will not depend on the funds. There are simple, cheap ways to prevent the incidence of HIV. We should also consider the lifestyle measures that are key, and again train our people and prepare to completely take over the care for people living with HIV/AIDS. Thank you.
Okay. Now, I'm being told that Dr. Disu has joined us back. Dr. Disu, if you can hear me, please go ahead with your final thoughts.
Okay, so what I think is we need a whole of society approach here. We need the community members to play an active role in this. Civil society organization needs to be really involved. They need to be up and doing, advocating for access to treatment, and then also for testing. And then we also need our government at all levels to ensure that there is increased funding. Then there is accountability of those funding to ensure that there is no leakage. It gets through those people who really need these services, whether in terms of products or in terms of training the health workforce that need to deliver this and ensure the efficient logistics system. So we need to be looking at cost-effective interventions, integrating this into our routine services, especially our primary health care, like we said, and also involving the community, create massive awareness, and then invest massively in health education, and to bring this language, these messages down to the language that they understand, and ensure they are involved in the creation of these messages and these strategies, the intervention, because the diseases affect people in the community. And then when the community is impacted, issue of stigma, issue of economy, issue of liberty, and the way they want to even preserve their culture, they are all going to be affected. So they should take ownership with support from government, and also the private sector needs to also be involved in this. So there are a lot of untapped resources, corporate social responsibility, and they can actually come in if we do the right advocacy to them to see how they can ensure that the existing gaps that we have are quickly plugged, and then also put measures in place in building resilience in such a way that even, like Dr. Odubanjo said, COVID-19 pandemic, it disrupted HIV treatment and prevention services, so, and testing services. So any other thing can come. Even within the country, we will have a disruption. What about places where they have issue with security, and then third, where we need a multi-hazard approach, engage security agencies and everybody that needs to be involved to ensure that we provide these services. It's available, both treatment, prevention, and then also testing services to everybody. And also talk to reduce stigma of HIV, so that, because by the time we say that, people are free to come out to say that they want to do the test when they are available, and they are able to also comply with their medication if they understand the benefit to themselves and then also to their family members and the larger society. Technology is key. Massive investment in technology. Ministry of Technology or Communication, ICT, wherever ministry that is involved, they need to be thinking of how to ensure that technology gets to our rural communities. We can do it in Nigeria. Rwanda, we go to Rwanda, that doesn't have as much resources as Nigeria has. They have optimized use of technology. It can solve many of our problems. We need data scientists. People can do modeling, and they can do prediction of, in terms of behavior change, in terms of treatment, in terms of prevalence of these diseases, and then to tailor it down to different community and different key groups, target different segments of the audiences, so that we'll be able to target people based on their peculiarities. So it's a serious thing, and we use one health approach in this. HIV should be part of other health interventions. It should not be treated as an isolated program. It's just an indication that we need to do more to our health system.
Okay. Well, thank you so much. We really appreciate you for your time and also for speaking to us on this very important topic. Dr. Yahya Disu, Executive Director, AfriHealth for Social Development and Impact in Abuja. We also had Dr. Ibitrokoemi Faye-Korubo, consultant endocrinologist and diabetologist, and also acting head of Department of Internal Medicine in RSUTH, that's in Lagos. And we also had Dr. Doyin Odubanjo, Executive Secretary, the Nigerian Academy of Science, Lagos. We appreciate you for your time.
Thank you for having us, Sachin.
And that's a wrap on The Conversation. Thank you so much for staying tuned. I remain Darshan Usman. Bye for now.